This is how 58-year-old UAMS family practice physician Charles Smith spends his days at work, in and out of exam rooms, diagnosing medical problems that bring patients to him and making them better.
Good morning.
Good morning.
So, we're here today following up from last time.
Yes. When not working, Dr. Smith is known for keeping a fast pace, tennis, skiing, golf, and frequent extended walks with his wife, Connie.
And then I graduated, transitioned to biking primarily as my primary aerobic activity because I still enjoyed being outside. And within the past year and a half, I've had to back off of that. And actually, sometimes when I walked, many times I'd walk with my wife. She and I enjoy walking together. And we may go for an hour and a half or so at a pretty brisk clip.
But in recent years, Dr. Smith's left knee has not permitted him to maintain that brisk clip. Where did that pain come from? And why was it getting worse? At times becoming overwhelming, eventually causing a limp, and the realization that his knee was wearing out. That wasn't supposed to happen, especially to an active, quick-stepping doctor dedicated to health and physical fitness.
So that's running, kind of gave that up. Biking, kind of gave that up. And walking, now I'm really having to give that up. More pain sooner over the weeks and months. And I just knew that my knee was just gradually getting worse. You know, I don't really want to do this major surgery, but I also value my activity and as such an integral part of my life and what makes me feel good about being alive.
Then came the x-rays, the MRIs, the exam by nationally respected UAMS hip and knee surgeon Richard Evans, followed by the news that Dr. Smith did not want to hear, the news that he would need a knee replacement.
You have some joint space preservation based on the MRI. Or based on the x-ray, but the MRI, which we do in these kind of cases, generally tells us more, as you would expect. Yeah. And you're down to some areas of what we call grade 4 coagulation, or just bare bone.
For Dr. Smith's left knee, the pictures tell the story. Just as UAMS surgeon Richard Evans diagnosed, Dr. Smith's left knee would never again see a day without pain and desperately needed replacement. Initially, several options were considered.
Reduce, which is a partial replacement of the kneecap and just the medial side of the compartment. And this has just been released within the last couple of months.
In the past, patients suffered for years with arthritic knees, having to wait until they were old enough for total knee replacement. Now, that wait can be cut short by a new innovative procedure, available in Arkansas only at UAMS.
The amount of people that we put these partial replacements in this new technology in is almost universally positive. People that are relatively young.
Dr. Richard Evans is among the first in the United States to perform the bicompartmental knee resurfacing, after becoming certified for the procedure along with a select group of orthopedic surgeons, primarily from academic medical institutions. Patients in their 60s, 50s, and even 40s can benefit from this procedure by having less than a full knee replacement. Ligaments are not removed, allowing the implant to feel more like a normal knee than a full replacement.
So the advantage of the smaller surgery is also that it's generally, the smaller implants are that it's generally smaller surgeries.
Knee implant patients, such as Raymond Foltz of Cabot, can even walk with relative comfort within hours of the surgery. This hour-long procedure removes painful arthritic bone surfaces and gives early interventional treatment for many patients who are too young for a total knee replacement, but who are in desperate need of pain relief.
We have all these baby boomers passing into their 60s, and we're going to have more joint replacements going on in this country now than we ever have had.
In the case of Dr. Smith's knee, additional examinations and images found the damage to be more extensive than initially diagnosed. Instead of the smaller bicompartmental knee resurfacing, Dr. Smith's knee would require a total knee replacement with a high-demand oxinium-coated implant.
The total knee replacement and the total hip replacement have been around literally for decades and are very successful, 95% or better success rate in almost anybody's hands.
With Dr. Evans guiding the procedure, Dr. Smith's choice of Pink Floyd in the music system, and the operating team in place, surgery began. Under epidural anesthesia, Dr. Smith remained awake throughout the hour-and-a-half procedure, vigilant, monitoring, adjusting to the unfamiliar role of being the patient.
Just knowing what they're doing. I mean, there's just something nice about that. It's your knee. I mean, it relaxes me to know what they're doing. Dang, it doesn't look too different than it used to.
Well, his knee was worse than we expected. Certainly not as bad as we often see in older folks. And he's very big bone, and the technical difficulty was just that he has very hard bone. So it took us a little longer than normal just because it took longer to soften his hard bone. But other than that, it was very routine. He got the highest tech device that's on the market. It will last longer than anything else.
Now is my knee already able to fully extend?
Yes, sir. You're already there.
Unbelievable. Thanks again.